So my background is I'm a children's nurse by trade. Grew up on the children's intensive care unit where I started my career, and I worked there for 10 years at Leeds. And then I moved on to Martin House, who I've collaborated with as one of their team leaders, and I was there for 2 years. And then I moved on for the last 5 years. I've been a specialist nurse for organ donation, supporting families through the organ donation process on the intensive care units throughout Yorkshire. So I'm just going to tell you a little bit to start off with about the two services, and then we'll go on to tell you about what we've done. So Martin House, for those of you who don't know, is a children's hospice in Yorkshire, and it covers the west, north and east of Yorkshire. It's a 15-bedded hospice and takes referrals from the age of 0 to 19, and they care for young people up to the age of 30. They have a caseload of 430 young people, and at Martin House they have 3 cool rooms, which is what we're really talking about today. Up until this piece of work was carried out, they usually just looked after children that were known to Martin House, and that's one of the things that we have changed. I work for NHS Blood and Transplant, which is an offshoot of the NHS, and they focus on organ, blood and tissue donation. My role specifically for solid organ donation. I work in the Yorkshire team. We are a group of 18 specialist nurses and 2 team managers, and we cover 35 hospitals throughout Yorkshire and Lincolnshire. All of those hospitals are hospitals with intensive care units and 2 regional paediatric intensive care units. I don't want to teach people to suck eggs, but I don't know whether anybody knows much about organ donation in the room. A lot of people don't realise that to be a solid organ donor, you need to be on an intensive care unit, you need to be on a ventilator, receiving treatment. We have to have something to withdraw and take away. So unless you're on an intensive care unit, you couldn't be a solid organ donor. So that's why I'm specifically talking about intensive care units. And the role of a specialist nurse for organ donation, again, just to briefly tell you, because you may not have ever met one before, is if there's a patient on an intensive care unit anywhere where futility has been declared, or they know that they're going to brainstem death test a patient, they would refer that patient to the specialist nurse for organ donation. I'm going to start calling them SNODs now, because it's such a mouthful every time I have to say it. So we're called SNODs, that's what everybody knows us as. So they're referred to us, we go to the ICU, we look at their past medical history, we speak to GPs, school nurses, anybody that we can get hold of to give us an idea of their past. Once we've had a look at that and we know that there's nothing that would preclude organ donation, we then approach the family about organ donation and see if it's something that they would like to honour. Obviously, some of the adult population are on the ODR, and we ask families to support that decision that that person's made in life. But for parents, usually that's a decision that maybe they've never thought about before. I was just having a conversation down here, and actually the year I'm talking about, 2017 to 2018, the 5 organ donors that we had at Leeds Teaching Hospitals on the paediatric intensive care, it was their families that approached us, not the other way around. Once we know that the family wants to go ahead with organ donation, we then support that family and we coordinate the whole process from start to finish. We don't leave that patient until they're moved to the mortuary, or in this case to Martin House. We also do a lot of follow-up post-donation with our families, keep in touch with them, let them know how the recipients are doing, and we write letters to them regularly. So that's basically the two lots of the organisations that have come together to collaborate in this instance. So the background to this piece of work is that when I started as a specialist nurse, I realised that from a paediatric point of view, there's a lack of support for these patients' families following donation. They're offered 12 weeks after donation a 1-hour appointment with the intensive care consultant, and that's it. There's no more support for them. So I was quite horrified when I started in the role, after coming from somewhere like Martin House, where they look after their families, they give them the bereavement support that every family should have. I realised that this was something that we needed to change, and we needed to change it quickly. So I approached Martin House and asked them to support me with this. I should have shown you that before, sorry, I completely forgot about the slides. So I knew that ICU sometimes send their patients to Martin House for compassionate extubation, And on occasion, sometimes, if the patient's too unstable to move, then they go after their death to Martin House to give that family time with the loved one. But formally, it wasn't something that was done from a donation point of view. Just to give you some stats, that from organ donation from 2017 to 18, just so you've got an idea of numbers in your head, in the UK, there was 1,574 solid organ donors in the UK. 34 of those were paediatrics. In Yorkshire itself, 144 of those were our donors, and just 5 were paediatric donors. So we're talking very small numbers. Initially, when I approached Martin House, they were worried about how this would impact on them from a number of children that we would expect to take that post-donation. But like I say, it's very, very tiny. The most paediatric donors we've ever had in 1 year is 10 in Leeds. So it's teeny tiny numbers we're talking about. So we did start by just the first patient that I referred came, we saw how it went, we learned from it. As time went on, we kind of realised that there were some barriers, there were some worries from the hospice staff. They were worried about how this would change the feel of the hospice. Are we using the hospice as a mortuary? Is it really the right way to use the hospice facilities? Some of the staff had some concerns about it, so we decided to hold a focus group after we'd done a few donors. And we asked them to come prepared, and these were the questions that we gave them to come to the focus group with. We asked them what are the benefits to the families, the challenges, what are the benefits to you as a professional, what are the changes you need to make to the way you work, and what have the main learning points been, and what still needs to be done. I didn't mention that my colleagues are specialist nurses for organ donation. The majority of them are adult nurses, so they've never experienced paediatric death before. They've never supported families on losing a young child. So this is very foreign to them, and this is one of the reasons that we also needed help. I was the only paediatric nurse in the whole of the team, and was experienced with looking after patients post-death, young patients and families, but the rest of my team weren't, and as adult nurses, that gave them a lot of anxiety. And they felt like they were doing a disservice, if you like, to the families, because there was no time to spend with them afterwards. By going to Martin House, that gives the family, these are usually really rushed, tragic deaths. They're, within 24 hours from coming into hospital to donating. It's something that they've not had their chance to get a head round, they weren't expecting it, usual, real tragic circumstances. So coming to Martin House just gives them the time and space to breathe and realise what's happened and spend some time with their child without having to go home and leave their child in the hospital mortuary. So during the focus group, they'd have the questions, and then we all joined together at Martin House. And everyone was really great at giving their points of view, realising where we'd come from. Because actually, once we'd done a few of these children, once we sent a few of these children to Martin House post-donation, actually the staff really realised the benefit of them going there for the families. We had to do some education because it came through during the focus group that they didn't understand. Number one, didn't understand organ donation because they'd never been involved with it before, and didn't understand what was involved with the process. So we did some education and study days with the ICU staff and the Martin House staff, telling them, sharing information really. So the ICU staff could share what happens on ICU before they get to Martin House, and Martin House could share what they can give for the families after they've gone to Martin House. So it was a real sharing exercise where everybody learnt a lot. And then the specialist nurses for organ donation, I organised some events where they could come along to Martin House and experience Martin House for themselves. They got to look around, see the cool rooms, and they had some teaching from the staff about what they offer families. So it was a real sharing environment and a really good way of, it's easy for me to tell my colleagues what Martin House is, but you don't understand it until you actually experience it yourself. So that was how we went around educating the two lots of people. It was recognised as a big change, and from the focus group we came up with themes and what we could do about it. So We all sat down, we transcribed the conversation, and then we took out the themes following the conversation. Afterwards, the researchers sat down together, took the themes out, and then realised how far we'd come from the start of the piece of work. Like I say, the staff realised that it wasn't a bad thing, it was a good thing, that these families were then getting the support that they required, and not just being left to sort of flounder on their own, not knowing which direction to go in. They get 2 years of bereavement support, and they also get invited, so if there's siblings of the patient, they get to go to the sibling groups, the parents get to go to parents groups, and there's even grandparents groups. The whole family are looked after. And the grandparents are sometimes forgotten about, that they need to learn how to support their children in the loss of their child. So it's just a really great thing for the whole family to get together and be able to experience that. So in the end, both sides could see that there was huge benefit for the families, and that we couldn't work unless we did this collaboratively, and that by us all coming together, we've managed to give the families the gold standard care that they deserve. SNODS felt that there was a weight lifted off their shoulders because they felt like they could take the children to Martin House, and they knew that they were going to be looked after. You know, my colleagues who aren't paediatric nurses, who aren't experienced, just didn't know how to care for these people and didn't know what time to give them. They were scared to go and see them at home because they thought they were going to ask them questions that they didn't know the answers to. We're not qualified to sit and counsel patients and patients' families. Martin House, however, are the experts in that. And families that I know that I've been involved with have said they don't know where they would be right now if they hadn't gone to Martin House and hadn't been given the time and support. One of my colleagues, before we started doing this, spent 3 days trying to get support for a family, tried all avenues, and in the end was in tears because nobody would help them. They just kept getting told, it's not been 6 months yet, you need to give them time. Well, actually, no, that family needed help now, and we were useless, and we weren't able to do that for them. We just had to meander ourselves through it and support them until we got to 6 months, and then somebody would come and help them. So all of this has enabled better care through the collaboration of agencies. And in conclusion, nurses perceived that the long-term responsive and family-centred approach to bereavement support was regarded as a strength to the hospice model, reducing the experience of moral distress in the SNODS workload. This interagency initiative is an example of how, by working across organisational boundaries, relevant care can be provided to families, supporting them post-donation and reflecting contemporary need and providing an increased sense of role satisfaction in nurses who support a family at any stage of their organ donation journey. I'd like to take this opportunity to say thank you to Martin House for helping us with this and for enabling these families to get the support that they truly deserve. From the 5 children that in 2017 to 18 used the services of Martin House post-donation, saved the lives of 21 people. So, you know, that those families deserve to be looked after properly when they've given so much.